I'm gonna knock on the door. Hi, my name is Cassie Meyer. Let me perform hand hygiene really quickly. Nice to meet you. I'm a nursing student at the University of South Alabama, and if it's all right with you, I'm going to be performing a respiratory assessment.
Yes.
Okay. So first thing I would check for during the respiratory assessment is his respiratory rate or his breaths per minute, and they should be 12 to 20 or 10 to 20. And next I would check for his breathing patterns. Okay, I would check for his breathing patterns to make sure that they were regular and not irregular. If they were irregular, then he would be using some accessory muscles to help him breathe. Next, I will be looking at how deeply he breathes, so whether he could be breathing shallow, deep, or moderate breaths. And that means that if he had moderate breathing, then he would have a gentle rise and fall of the chest. If he had deep breaths, then it would be a very noticeable rise and fall of the chest. And if they were shallow breaths, then it would be a slight rise and fall of the chest that you wouldn't be able to see very easily. Okay, next I'm going to be looking at your thorax, and the first thing I'm going to examine is your transverse anterior and posterior ratio. So I see that it is a 2-to-1 ratio, which means that there is no barrel chest. And next I'm going to check for any cuts or skin lesions or any scarring anteriorly and posteriorly. And I don't see any, and I would also check, I will also check for the color of his skin to make sure it matches his neck and his face and his hands and his feet as well. So can I see your hands? Thank you. Okay. And I don't see any abnormal color findings. And next I'm going to be checking his hair, and his hair pattern is coarse, like normal male hair. And lastly, I'm going to, that's it for the skin assessment. Now I'm going to be examining your mucous membranes. So first I'm going to look at your lips using this light. And I see that they are pink and moist and no signs of cyanosis. And can you open your mouth for me? And I'm looking at the buccal mucosa, and they are also pink and moist without any signs of cyanosis. Okay, next, may I see your hands? Because I'm going to look at the capillary beds and make sure that they're pink, which they are. Let me see your hand. And there are also no signs of cyanosis either, which is good. And next I'm going to check the angle of your nails to make sure that it is convex, and they are. And then can I ask you to put 2 of your fingers together? And when he puts his 2 fingers together, I see that there is a diamond shape, which is good. You can go ahead and put your hands down. And that means that there is no clubbing of the fingers, which is good. And lastly, I'm going to perform a capillary refill test. And so I'm going to push down on one of your nails and see how quickly the color comes back. Okay, so the color returned in less than 3 seconds, which is what it should do. So next I'm going to palpate both anteriorly and posteriorly on your chest. Okay, so when I palpated, I didn't see any or feel any crepidation, which would be like pops in the lungs to see, and this would make sure that his lungs are functioning well. And next I'm going to check the chest expansion anteriorly and posteriorly, so I'm going to put my hands on your chest and just take a deep breath when I tell you to. Go ahead. Okay, and So and his chest expansion was equal and symmetrical, so that is good. They both rise and fell at the same time, both anteriorly and posteriorly. And now I'm going to be auscultating on his chest as well, and back, anteriorly and posteriorly. So what I'm going to ask you to do when I listen to your breathing rates is just breathe a little bit deeper than normal, but also breathe through your mouth. Okay, could you turn it around for me? All right, and last one. Okay. So what I found when I was auscultating is that his vestibular, bronchovestibular, and bronchial regions of the chest, those are the three that I checked. So first I'm going to tell you about the bronchial region of the chest, which covers the larynx and the trachea. And what I heard when I was listening is a high pitch and a high intensity sound, and that is normal, as well as less inspiration than expiration. And then I auscultated over the middle portion of your chest, which is the bronchovestibular portion of your chest, and it holds the main bronchi of the body. And what I found were inspirations were equal to expirations, and I also noticed that the pitch was moderate as well as the intensity. Lastly, I auscultated over the vesicular portion of the chest, which is the peripheral lung area, and the expirations were greater than, I said that wrong, the inspirations were greater than the expirations, and the pitch was lower as well as the intensity. So overall, the breaths were clear to auscultation bilaterally, and there was no adventitious findings, and that means that if there were any crackles, that would be a sign of pneumonia, and there was no wheezing, and that would have indicated asthma. So that is the end of my respiratory checkoff. Thank you.